A Beautiful Mind by Annette and Sofia. This presentation will focus on the film A Beautiful Mind, in whom John Nash is the main character. Nash attends Princeton as a mathematics graduate student, thus showing his advanced intelligence and knack of numbers. We later find out throughout the movie that Nash suffers from schizophrenia, and some of the characters that he creates are actually a figment of his imagination. Schizophrenia is a disorder defined by abnormalities in one or more of the following 5 domains, which include delusions, hallucinations, disorganized thinking, grossly disorganized or abnormal motor behavior, and negative symptoms. Nash in particular is specifically affected by the hallucinations and delusional domains, seeing as he created a realm of acquaintances around him, and he thought the Soviets were after him. Delusions and hallucinations. The primary problem for Nash was his inability to distinguish between reality and his delusions. During his delusional periods, Nash created imaginary characters, such as Charles, who he meets at college, as well as William Parcher, who assigned Nash a task to look for patterns in magazines and newspapers in order to prevent a Soviet plot. Nash's delusions were very complex and very thought out, which is why it's so hard for him and a shock to the audience when it's revealed that it's all in his brain. Nash didn't acquire one of the symptoms listed in the DSM-5, repetitive speech. He was quite organized when it came to his imaginations and did not need to repeat his speech, phrases, or words. He did not have social isolation when he was younger. However, in college he was rather reserved, but he had his friends in his head. The only reason he does not entirely lack an interpersonal relationship, which is also a symptom of schizophrenia, is due to his marriage with Alicia. Usually schizophrenics don't have the capacity to have such a commitment with the person due to their state of mind. There are 3 main treatment plans for schizophrenia. One is insulin coma therapy. In the film, Nash is repeatedly injected with large doses of insulin in order to produce daily comas over several weeks. Another treatment is electroshock therapy, which is a procedure done under general anesthesia in which small electric currents are passed through the brain, intentionally triggering a brief seizure. Another treatment is antipsychotic pharmaceutical drug therapy, where narcoleptics or major tranquilizers used to manage psychosis. There are, however, problems and side effects to these treatments, which can be severe restlessness, depression, anxiety, difficulty concentrating, and Parkinsonism. And these side effects usually lead the patient to gradually halt their medication intake and cause them to potentially see their hallucinations again, which is what is depicted in the movie with John Nash. There are only 3 medications that have been proven to have the least severe side effects, which are listed in the final bullet point on the slide. This movie was an accurate portrayal of a schizophrenic person because it's based on a true story and a true schizophrenic person. Nash's hallucinations and delusions were so real, even to the point that the audience had a hard time believing it was all in his head. His realizations of his imaginations was so monumental that it makes it much more admirable that he chose to accept what he had and treat it for him, his wife, and his baby. It is frightening to deal with someone like Nash because we don't know what's going on in their head, so the things we can't understand scare us. So thus the character of Alicia is a very accurate portrayal of how a wife of a schizophrenic would act. She was scared, she did not know what to do or how to even react, but she chose to stay and be a part of his recovery. Perhaps it's good to have a beautiful mind, but an even greater gift is to discover a beautiful heart. John Nash.